Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to talk about this temporomandibular joint some today and tell you some facts about it that everybody ought to know about. If you mess with people's teeth, you ought to understand the temporomandibular joint. It is something that is very elusive in figuring it out, but there's something about it that everybody ought to know that works on people's teeth. And even if you don't work on it and you are out here and you have a problem with it, you ought to understand it yourself. Now, let's get started here. There's a lot of just innovative ideas that you can find out if you know what's actually causing the problem like this. Now, so if you're having problems with it, if you put your fingers right in front of your ear here and open your mouth and move it back and forth, you can feel the condyles sticking up back here in the fossa. And when you move your mouth to one side like this, one of the condyles moves out of the fossa and is hidden, and you can only chew with the teeth on one side. If you want to bite over here, you have to shift your jaw over. And if you want to bite on this side, you bring it over here. This condyle drops out of the fossa also. And if you have problems with it, a lot of times you just bring your jaw to the front and your condyles move forward, but you can't do any chewing up here in the front without pressing on it. So that bothers people. So you wear a splint that brings your jaw forward. And about 90-some-odd% of the pain up there, the condyle is pressing into the retrodiscal tissue, which is highly vascular, and that's where the synovial fluid forms, and that's where the food for the disc forms in this area. While I was working with for a dentist, a good friend of mine, Dr. Mike Hurley, took over our practice, and then I worked for him about 12 years and did the orthodontics and the TMJ work with him. And when I first got to know Dr. Hurley, I went out to lunch with him one time, and he was eating dinner, and he brought his front teeth out here, chewed for a while, and then he would go back in the other way, and he would bite back here and chew for a little bit, and then he'd come back out here and chew. And I kept looking at him and watching what he was doing. He wasn't talking anything about it. It wasn't hurting that terribly bad, but he'd bring his teeth out here. And I said, what the heck are you doing? He said, well, if I chew back here, this hurts. And so I bring my jaw out here, I can't chew as good, but I bring my jaw forward and it stops hurting. So this is the thing in a nutshell. If the jaw joint hurts, put your finger back here, and if you close your teeth and they're sore at all, they should not be sore. I mean, you should be able to feel on the sides of your jaw, everything like that, if it's functioning right. Well, if it hurts when you go back here and you bring your jaw forward, if you could move your upper teeth forward or move the jaw forward, you have to get your upper teeth forward so that they fit together. I'm going to go on here and we'll just open something where I can draw on here. Now in Mike's case, we put some screws in the bone and we pulled on it to get the jaw to move forward. This is a pretty hard way to do. So it's a little easier if you go in and say you just need to move the upper jaw in a forward direction, just a small amount. What is the simplest thing to do is, let me just draw something here. We'll make a deal. If your teeth are fitting in like this, I'll just draw a couple of teeth coming in like this, and they're fitting together with the lower teeth that are coming up in the underneath here. If you come in and strip all the teeth in here like this, and you close those strip places, and you go down on the bottom teeth, let's just say these are teeth, we go in and strip in between the bottom teeth, and we've stripped in between the upper teeth. Now we want to close this space by moving the upper teeth forward. So we wear class 3 elastics like this. We're coming in here, so we come in and we move these teeth in the forward direction with class 3 elastics, and that moves the bottom teeth back with the class 3 elastics. So you've got space in between these teeth, and now we have moved these teeth in a forward direction, and the teeth don't fit in the groove here, so now the lower teeth that have closed the space going back here can move their teeth forward and close into that, and that will bring your upper jaw and your lower jaw relationship. It'll bring the lower teeth out, away, and a lot of times the fossa, something like here, and the condyle is fitting up in here, and if you can bring it out just a little bit, it will solve your problem and stop pressing into this tissue back here in the back. And that's the simplest way that I know of to actually move the relationship of the lower teeth to the upper teeth. We haven't really moved the teeth much, but we made some space in there, and you bring these have to move forward to fit into the gaps that are opened, that are closed up, and these teeth have moved forward. That's one simple way to move the lower jaw in a forward direction. Now another way is that you can tip the upper teeth, like the teeth are sitting in here, and you bend an arch wire and you put it in with these. You come like this, and you drop this down and up, and then you come back, you go up, go down again and up, and you do that like, in other words, your arch wire comes out like this. In other words, you put bends in this, and that will tip the upper teeth in a forward direction. And you come in and do the bottom tooth reverse of that. In other words, your tooth is going here, and you want to tip this back like that, so you make this go like that on the bottom arch, and that'll move the bottom teeth back some, and you move these teeth forward some. So now the bottom jaw, to fit against this, has to move out. And so these two methods, you can move the jaw in a forward direction and get the condyle off the retrodiscal tissue. I went to a lecture one time, and the guy went through all this problem. He knew that he had to bring the teeth forward, but he didn't know how to fix the teeth where they fit in a more forward direction. See? So what, I'm going to erase that. That's a pretty sorry looking deal there. And I'm going to erase that and come back with another deal. So in tipping the upper teeth forward, you bend an arch wire that goes like this, up, down and up, down and up, down and up, down and up, like that. And that brings these forward teeth that way. On the bottom, you tip in reverse. Now to see that, your tooth is here. You want to move it back this way. You need to put a tip in it, and that fits in the bracket, and that makes the tooth move. The bottom teeth will move in a backward direction, and the upper teeth in a forward direction. Now the bottom teeth have to be brought forward to fit into the gap of the upper teeth, and that makes the whole jaw come forward. And so that's really what we ended up doing with Dr. Michael Worley's teeth. We could get his teeth out here, and that would keep it off of this condyle so he could chew in one position out here. Now there are other ways to bring the upper teeth out further, and you can bring them a lot further if you just put class 3 elastics, but then you have wearing the elastics. If you've got sore jaws, sore joints, it gives you problems there. So this is something I just wanted to pass on to people, is that this is kind of what we did with his teeth. And now I'll go back and see if I can run through some of the stuff we did with his teeth. Let me see if we can pull him up here. So we tried put the screws in the bone and sliding it forward. The teeth would slide and the screw wouldn't. You see, that brings it out. And that was one way we did some of that. And we did some tipping. You see how the teeth were tipped like that. And that brought them forward. And we tipped these going in the backward direction. All right, I made a little gadget that would put some force on that, and you have to screw it into the bone, and it would push them. But that was a lot of trouble. That was a thing. It just didn't work good. So we did away with that. We came back to the other deal. And here we lowered the arch where he was biting with his lower teeth were bumping up against the upper teeth. We got these up. You see this deal going here and this one coming down here. In other words, we separated the teeth. Then it could bring the bottom teeth forward, and that stopped the hurting too. So that's another way that you can get the teeth to fit further to the front. If you've got a closed bite, you open it, and they could come out here like that. The teeth will just move out a lot of times on their own to that point. Now let's see if we did some other things that helped bring that out with these intruding arches. We leveled it out and was able to bring the teeth forward. So anyway, we got his teeth out like that and pull that out, and they fit together. And I'm going to run through the rest of his working on his teeth like that. And we got him out there, and he had a kind of a bad tooth there that we had to do something with. But we made it come out like that, tipping those teeth. And that's the way we ended up working on him, and he was the guy that I was working for. There, he had a cuspid over here that was in bad shape, and this is a normal cuspid. This was bad cuspid over there. I'll flip through this real quick. We bonded these together down here that held them in place. And this is some stuff that I don't recommend. We tried using stuff. Here is Dr. Hurley's picture back then. He's a very successful dentist right now. And that was the way he was chewing back like that, sticking his jaw forward, and then he'd come down. And he'd go back and forth like that. So we were able to bring these teeth out, and now we closed these back, but it made them fit better if he brought them forward, and he could bring it out like that. So the major problem with TMJ is that the condyle is pushing back into this tissue, and you need to make a splint really and go in and correct it. So I'm going to close out on this. There is a way you can take a mouth guard, like a football mouth guard, and if you soften it up and then bring your teeth forward where they don't hurt and bite into that mouth guard, it'll make a kind of a temporary splint that you can wear to get rid of pain that you may be having in the joint. That's something individual can do. In other words, your teeth would fit into that, and you'd have to chew with that, but you need a splint in there that covers the teeth back here and has a ramp in it, and when your bottom teeth hit it, they have to go forward right there. So anyway, we got him fixed up, and he doesn't have any problem with that nowadays. So thank you for watching, and I'm going to go ahead and close out, and we'll talk with you later. Thank you very much.